Unit's Use of Force Act 2018. It's a significant advance, and he deserves enormous credit, together with Olaseni Lewis, who's tragically lost his life through the use of restraint, and his parents who fought so hard for justice. I'd also like to pay tribute to the Challenging Behaviour Foundation and to Viv Cooper, who runs that brilliant organisation, and to Positive and Active Behaviour Support Scotland and its founder Beth Morrison for the brilliant work that they do. I'm not going to take interventions because I'm under strict instructions that I've got to keep to time. So if members could accept that, with my apologies. Madam Deputy Speaker, this is a debate about the human rights of children, and I'm afraid to say that abuse of children is endemic through the system. And I'm afraid that the government is complicit with the abuse of children for failing to get to grips with it and for not issuing guidance that is now 5 years overdue. And I will develop my points in due course. What are we talking about? Well, this is the restrictions that are imposed on children include physical restraint, which includes prone restraint, where an individual, in this case a child, is held to the floor with their face down to the floor. It includes seclusion, where a child is locked in a room, often children with acute and complex autism who will be in a state of acute anxiety. It includes mechanical restraint, where a child, for example, might be tied to a chair or to a bed. Blanket restrictions, which might involve preventing them from going outside. And chemical restraint. The settings that we're talking about include residential schools, special schools, mainstream schools as well, incidentally, children's homes and assessment and treatment centres and hospitals within the NHS. Just by way of example, when I was Minister, I visited a girl called Fawzia. She was admitted to St Andrew's Hospital in Northampton at the age of 15. She was there for nearly 2 years. When I visited her, I heard from her family that she'd been subject to constant use of restraint, was prevented from going outside most of the time, and was often secluded into a room which, frankly, was like a prison cell. I visited her 2 years later, after we'd got her out of that institution, where she was being cared for by an organisation that understood that you have to train staff in how autism affects an individual. And in the period since she had been discharged from St Andrews to the day I visited her 2 years later, she hadn't been restrained on a single occasion. Now, we have to read something into that, which is, I think, quite profound. I also met with Leo, the mother of Stephen, who has autism and a learning disability. A harrowing story of a child subject to prone restraint in a special school, having then being referred to a residential school in Norfolk. Again, the use of prone restraint, serious medical conditions being ignored and not being properly addressed, which ended up being rushed to hospital because actually a bump on his head turned out to be a brain hemorrhage, which had been ignored for several weeks. And I also, incidentally, have been contacted by Deirdre Shakespeare, whose son Harry has been subject to mechanical restraint, being tied to a chair, legs tied to the chair as well. Deirdre and her son live in Tyrone in Northern Ireland, and her concern is that with the collapse of power sharing, there is simply no authority in Northern Ireland to address these very serious concerns, which, in my view, as I've said, amount to human rights abuses. Now, the scale of the problem, this is, as I said at the start, endemic in the system. The Challenging Behaviour Foundation carried out a survey with 204 respondents. 88% said that their disabled child had experienced physical restraint, 35% reporting it happened regularly. 71% of families completing the survey said that their child had experienced seclusion. Over half of the cases of physical intervention or seclusion, just note this, over half reported were of children between the ages of 5 and 10. These are small children who are being treated in an entirely inappropriate way. 58% of families said that their children experienced restraint that had led to an injury. 91% of Challenging Behaviour Foundation survey respondents reported an emotional impact on their child. And then Five Live, who I applaud because they have featured this whole issue, they did a Freedom of Information survey in 2017. They identified 13,000 physical restraints over the previous 3-year period, but only a proportion of authorities had responded, I think a fifth, and they'd identified 731 injuries. This is of children in organisations where children are placed by the state. This is really shocking and, in my view, scandalous. And here's the thing. It doesn't need to happen in most cases. In most cases, it is avoidable with the proper culture and proper training of staff. In a report by Christine Lenihan, Dame Christine Lenihan, a leading expert in this field, commissioned by the government, she reports of a local authority officer who said there can be a vicious cycle occurring within the ASD cohort, people with autism. A poor provider triggers challenging behaviour or physical meltdowns or fails to prevent such events, often exacerbating this with their reactions, restraint, punishment or confinement. Good providers in whose care this behaviour may not have occurred will now not accept the child due to their history and pattern of risk. Therefore, the child is placed in a more restrictive or secure setting, which can result in a worsening situation. Eventually, the child reaches a secure NHS setting, which often is wholly inappropriate for their ASD needs. In different circumstances, a good specialist day placement could have worked for this child. That is really shocking, because so often the child who ends up in a secure setting never escapes from it again and spends their life in an institution. And this is happening within our society, behind locked doors, and it is wholly unacceptable. And Christine Lenihan, in her report, says that strategies such as positive behaviour support can be effective in managing challenging behaviour. Positive behaviour support assesses the relationship between environmental events and behaviour, identifies what can cause the behaviour, and uses proactive strategies to prevent it. One respondent to their call for evidence noted that using a positive behaviour support-informed strategy had coincided with an almost 90% reduction in the use of physical restraints. So here's the thing. If it's possible to avoid it, to use it is an abuse of that child's human rights. Full stop. There can be no compromise on this. We have to end it. And that's why it is so important that the Department for Education takes notice of this. Now, I wanted to contrast, Madam Deputy Speaker, the approach between the Department for Health and Social Care and the Department for Education, because I issued guidance in 2014 for adults as a Minister in the Department of Health, and it was designed to radically reduce the use of restraint and to end the use of prone restraint. Now we have a requirement which is going to be introduced into the formal NHS contract with requiring certified providers of training meeting a standard of training that avoids the use of restraint in the first place, rather than training staff how to use restraint. That is the key difference. So it's going to be embedded in the way in which the NHS works. It will be part of the CQC framework. But compare that with the Department for Education, where it seems like a wholly different culture seems to exist, where the child is seen as the problem, interfering with education and therefore disciplined, rather than understanding their needs. Surely we have a responsibility to understand what causes the behaviour in the first place. No promotion of positive behaviour support or any other preventive approach. So what a bizarre situation we have, Madam Deputy Speaker, where children are now less well protected from abuse than adults. That is surely unacceptable. There is no obligation to collect and report data on the use of restraint. or seclusion, and parents don't even have to be told when their child has force used against them. The guidance offered by Ofsted is very weak and needs to be absolutely reformed and reinforced. There is now a plan for legal action by 600 parents whose children have suffered physically or psychologically, and there is crowdfunding underway, and it will be a claim based on age discrimination and disability discrimination and the Human Rights Act. So I end, Madam Deputy Speaker, by putting to the Minister the following questions. When will the guidance be published? We've been waiting now 5 years for this guidance. How many children have suffered abuse in the meantime? Will it be based on an approach based on human rights? Will there be training as a requirement and at a certified standard? Will it be funded by the government to ensure that it happens across the country? Will the same approach apply whatever the setting the child is in? Madam Deputy Speaker, staff need support, they need training and they need guidance. But the bottom line is this: the abuse of children must stop and the government must act. We, and children in particular, have waited far too long.
The question is, as on the order paper, it will be obvious to the House that we have very little time left. I hope that we can manage without a formal time limit if everybody speaks for approximately 5 minutes. Anne-Marie Trevelyan.
Thank you, Madam Deputy Speaker. And it's an absolute pleasure to follow my right honourable friend, the member for North Norfolk, and to be able to work with him to try and get this problem resolved, a problem that needn't exist at all in our country. Madam Deputy Speaker, safeguarding children. We hear this